Hello, I'm here to discuss the intersection between mental illness and substance abuse. In 2022, the Journal of Community Health in New York stated that overdoses, both fatal and non-fatal, have increased rapidly in the United States since 1999 with the increased availability of prescription opioids. Additionally, the International Journal of Mental Health and Addiction posted a report in 2024 that stated that mental health disorders are a very common comorbidity seen in fatal drug overdoses. So we can see that substance abuse and mental illness commonly co-occur. This is known as a dual diagnosis. Dual diagnosis is merely the co-occurring of mental illness and a substance abuse disorder. Dual diagnoses are associated with an increased risk of suicide, interpersonal violence, hospitalization, criminal justice system involvement, and ultimately a premature death. Global studies of alcohol and substance abuse consistently point to the conclusion that mental health disorders and substance abuse disorders occur more often than can be explained by mere chance. U.S. National Comorbidity Survey in 2024 reported that 50.9% of respondents with an alcohol or substance abuse disorder also met criteria for at least one mental health disorder. So we can see that alcohol and drug use disorders are complicated by mental illness and create a poorer prognosis than each disorder would on its own. Why? Many researchers point to primary care being not sufficient to address comorbid conditions. Individuals with dual diagnoses are faced with a landscape of fractured care, where fragmentation between physical and mental health care leads to difficulty in diagnosing and treating these individuals. We can see this policy failure to address substance abuse disorders and mental illness in the rapidly rising rate of overdoses, both fatal and non-fatal. Since 1999, there has been a 467% increase in fatal overdoses, which now accounts for 28 in every 100,000 individuals. For individuals with a dual diagnosis, this also represents a lifespan that is shortened on average by 15 to 30 years. This also costs society. It places an undue burden on our healthcare system. For example, opioid-related overdose visits to the ER had a 27% increase between 2013 and 2020. Additionally, these comorbidities are associated with higher costs for a smaller percentage of the population, meaning more expensive care for fewer people. Mental health care is often not covered by standard health insurance plans, leaving taxpayers to pick up the check. What could be the reason for the frequency of this comorbidity? Self-medication hypothesis holds great weight in this arena. The hypothesis theorizes that opioid or substance abuse alleviates psychiatric symptom severity in psychiatric conditions, which places individuals at a heightened risk of habitual self-administration and ultimately addiction. To support this theory, we can look at the sedating effects of opioids and the reduction in symptom severity in PTSD patients. Stress also likely plays a large role in this issue. Biological predisposition to mental illness, which can be worsened by traumatic events, which can worsen both substance abuse and mental illness. Sociostructural exposures associated with substance use disorders predisposes individuals to higher rates of traumatization than non-substance abuse disorder populations. This places those who suffer from one condition at an increased risk of developing the other. Substance abuse increases the risk of traumatization. Traumatization increases the risk and severity of substance abuse, which perpetuates the substance abuse mental illness comorbidity cycle. Let's move on to healthcare. Interacting factors contribute to worsened healthcare outcomes for individuals with a dual diagnosis than individuals presenting either condition on its own. Symptoms of mental disorders and substance abuse often overlap, complicating a correct diagnosis. For example, hypervigilance and increased startle response are present in both sufferers of post-traumatic stress disorder and individuals suffering from acute opioid withdrawal. The historical separation of mental health care and physical health care and the lack of communication between primary care providers and specialists, if any at all, further complicates this issue. A great deal of evidence suggests that an integrative approach that addresses both conditions simultaneously holds the most promise. There is also suggestions that increased monitoring of non-fatal drug overdoses could prevent the increase in fatal overdoses. In 2022, the White House released the National Drug Control Strategy, which called for an expansion of reporting on non-fatal drug overdoses. The reasoning for this is that non-fatal overdoses are a key predictor of fatal overdoses, providing opportunity for social and medical intervention for sufferers. This would function similar to the poison control system and be known as a national drug early warning system. Localized outbreaks would be reported and increased importance would be assigned to them. To conclude, treatment of comorbid conditions of mental disorder and substance abuse presents a uniquely challenging and complex situation for healthcare providers. Due to a variety of factors, both biological and environmental in origin, individuals presenting with a substance abuse disorder or a mental health disorder are at a heightened risk of developing the other comorbid condition. The development of these comorbidities has been shown to be associated with an increased risk of interpersonal violence, poor quality of life, increased risk of hospitalization, and increased risk of suicide. Drug substance dependency is frequently associated with the presence of mental disorders in a variety of populations around the globe. Poor treatment outcomes and higher mortality rates than either condition on its own point to a public health emergency. Current health interventions focus on treatment of individual conditions on their own rather than an integrative approach, which is theorized to be more effective. Until the medical community can come to a consensus about comorbid conditions and the way to treat them, people will continue to die in higher numbers. Thank you.